I'm Dr. Roy, as Christina said, and this is my colleague, Dr. Mensah, who I begged him to come with me today because he's an expert in nutrition oncology. So Dr. Mensah has joined our practice from Maryland, and he's been with us for almost 2 years now. And he's a specialist in how food, exercise, sleep, and stress impact cancer and cancer survivorship. So my hope is he can help us answer some of those questions as we move along. And I see there's only a few of us here, and I just want to let you guys know this will be available to you guys through Gilda's if you want to watch it later so that you don't have to frantically take notes while we're talking. And we're in the Lake House location for Gilda's, which has just reopened and is a beautiful facility. They have a lot available here. I want you to check out Gilda's online and make sure that you see what services are in your area in St. Clair Shores and Grosse Pointe and the Detroit area. There's some chairs here, so if people do drift in to talk to us here, we might actually stand up and use the whiteboard. We might be talking to them. We might be talking to you directly. We just wanted to make sure, since most people are on Zoom, that you could see us easily. So let us know if you need us to repeat anything. And I just want to bring everybody's attention to the chat function. So it's on the bottom left of your screen. You might be able to see it there. You're going to chat it, put your questions in there anytime you have them. And if you're not super fast and you can't type very fast, it's also fine to unmute yourself and ask your question, or to raise your hand. And to raise your hand on the bottom right there under reactions, you would just click raise hand. Can you guys see my raise hand on here? No, I didn't do it right. Maybe we'll just use the chat or the unmute. Oh, there it is. Joyce raised her hand. Thank you, Joyce. How come all those hands are yellow? Joyce is more technologically savvy than we are. Okay, so we're here today to actually talk about hematological cancers, which sound very complicated. And I want to make this fairly simple. So while I talk about my piece and then we open it up for like questions and answers, I'm going to turn the computer away from you and just to me so I can use this computer to draw. So, first of all, in the chat or raising your hands or unmuting yourselves, I'd like to know what your questions are as I'm talking. Actually, I changed my mind. In the chat only, I'd like to know what your questions are as I'm talking so we can tailor this to your questions more specifically, because I'm going to start out very generally. And what I want to start out with is, where did I put my phone? What I want to start out with is hematological cancers in general. What does that mean? So when we're talking about hematological cancers, we're talking about cancers that begin usually in the bone marrow. So the bone marrow is responsible for making all of the white and red blood cells in our body. And this may be too basic for some of you. So again, if you throw your questions in the chat, it'll help me to make this and help Dr. Mensah to make this more specific. In the bone marrow, there's a type of cell called a pluripotent cell. What does that mean? Pluripotent. This is important for those of you who might get bone marrow transplant. It means it's a cell that can become anything, and it's called a stem cell. It's pluri meaning many, potent meaning powerful. It can become anything at all. And this cell can divide into two types of cells. These types of cells are called myeloid cells and lymphoid cells. Myeloid cells and lymphoid cells. And this may sound like Greek to a lot of you. It's definitely sometimes Greek to us as well, especially when we have all of these terms like acute myeloid leukemia, non-Hodgkin's lymphoma. So one of my jobs today is to make this very simple and easy for you guys to understand. And I'll circle back as I talk about this to what our role is in serving you with this type of diagnosis. So when someone says they have an acute myeloid leukemia or a B-cell lymphoma, they're specifically talking about the type of cell where the mistake was made. So this pluripotent stem cell becomes two types of cells, myeloid and lymphoid. The myeloid cells are the ones that become your red blood cells, your parasitic soldiers, so your basophils and eosinophils, these fight parasites. Your neutrophils, which fight bacterial infection. Your monocytes, which fight mold, pollen, and food sensitivities. What am I missing here? Nothing, right? Oh, and your platelets, which are the glue when you cut yourself that sticks things together. Okay, so all of these cells come from this precursor. So if someone has an acute, that means right now, it's not chronic, meaning it's not happening over time, right now, myeloid leukemia, it's a problem with these kinds of cells, which is why you might see things like bleeding problems or fungal infections or difficulty managing pneumonias or difficulty managing clotting, okay? A lymphoid cell, thank you, Christina, a lymphoid cell makes another kind of soldier here, and it's responsible for, I'm looking for a pen here, folks, and I'm drawing with one finger. So it's responsible for making two types of cells, or three types, excuse me. Can you mute people as they come in, Christina? B cells, T cells, and natural killer cells. So if someone tells me I have a T cell lymphoma, it means they have a problem with the cells downstream here. If they have acute myeloid leukemia, the problem is up here. If they have a B cell lymphoma, the problem is here. So what matters is what all of these cells do in terms of understanding how the disease behaves. So I'm going to stop for a second and just look and see if there's any questions so far. Thank you, Deborah. I appreciate your yes, but I don't see any questions so far. Okay. So as I'm going through this, some of these things may be beyond you. Some of these things may be unnecessary for you. Some of these things may be very useful. So you need to let me know, or we can't make this super useful. Okay. And it can be any question, like stop Dr. Roy and tell me what nutrition works for fighting an acute myeloid leukemia. That could be your question. Okay. So as we're working through this, so when we're looking at these types of cells, what matters is what they do. So our red blood cells are pickup trucks. They pick up oxygen and they deliver oxygen to our tissues. So these are gasoline trucks. So whenever we have a treatment that impacts the myeloid precursors and the bone marrow, we're always going to have fatigue because we have problems with delivering gasoline to the tissues. Our basophils and the eosinophils are parasitic soldiers. So they're the ones that manage parasites. And I'll check, Christine. I'm good at looking for it. Don't worry. I want them to kind of pile up a bit. Thank you. Eosinophils and basophils fight parasites. So that's why with someone with an acute myeloid leukemia, we might see some parasitic infections. Neutrophils fight bacterial infections. These are problematic because while a viral infection is very difficult to harm you, a bacterial infection is much easier to harm you because it's harder to fight a bacteria. So these are things where we might see a bacterial pneumonia. And so when our neutrophil counts are low, we might get growth stimulators or be held off of treatment until they recover. Monocytes fight mold, pollen, and food sensitivities, and platelets are the glue when you cut yourself that sticks things together. I'm drawing with one hand, guys, sorry. B cells, what are these important for? So B cells are the cells that fight infection in your body, foreign invaders. Now, both your B cells and your T cells will do this, but your B cells are, has anybody ever seen Star Wars? You know how they had those like clone soldiers, or all those white people, white masks with those big white bodies, and there's one after another, they all look the same. That's how I think of B cells. They're soldiers that clone themselves. So they encounter a virus, like this virus is coming in. It makes a weapon for this virus, and then makes 100 soldiers just for this virus. And that becomes a B cell troop. A T cell is a specialized soldier, and a natural killer cell fights cancer. Okay? So I'm going to pause here. I've given you a lot of information about terminology here. And let's just take a quick peek at the chat. So that's so funny. Steve asked the question, what nutrition is helpful for AML when you have a chance? So yeah, we'll come back to nutrition. Thank you so much, Steve, for that question. We're going to write down the questions here so we don't miss them, and we make sure we get to them. Okay, keep piling them on, you guys, all the questions you have. So before I go to nutrition and how we manage all of this, Steve, I do want to talk to you guys about how we get these cancers. So why does this happen? And for those of you who have been my patient before, you've seen this many times, so I apologize for it being a little bit redundant. So there's 3 ways in which we get cancer. And again, I'm drawing with one finger. The 3 ways are poor immune surveillance, increased rate of cell growth, and multiple mutations. What does this mean? So every single cell in your body, all those cells I just described to you, they're each making 2 daughters, and each daughter is making 2 more daughters, and so on and so forth. So when we have this cell division or this cell growth happening, every single cell in your body, before it makes its daughters, is stopped by border control. Border control, like at an airport, surveys this cell, immune surveillance, looks at this cell and checks for mistakes. If the cell has made a mistake, it tells the cell to kill itself. That's normal. That's happening all day. I'm sitting here right now. I'm drinking water out of a plastic bottle that's kind of soft, so my cells are exposed to some carcinogens there. The sun is coming through the window. It's hitting my face. My cells are making mistakes as they're exposed to those UV rays. Those mistakes don't get passed on because my border control catches those cells and either repairs those cells or tells those cells to kill themselves, okay? But if my border control is out smoking a cigarette, goofing off, flirting with the boys or the girls, what have you, then this cell, which has made a mistake, is allowed to pass that mistake on. That's cancer. So we're going to talk about the ways in which we upregulate our border control, but very briefly, these are things like high-dose vitamin D, for example, or polysaccharide extracts from mushrooms. And Dr. Mensah is going to talk about that when he talks about nutrition for AML, for example, okay? But that's not the only problem. Our only problem is not just our border control. Our next problem is anything that makes cells grow faster. So what makes cells grow faster? So whether it's leukemia, lymphoma, non-Hodgkin's, or Hodgkin's, there are 3 things that make cells grow faster. Did I just get on you? I'm sorry. Those 3 things are inflammation, environmental exposures, and hormones. What does that mean? So anything that causes your cells to, that causes inflammation in your body is going to increase the rate of cell growth, for example. So for things like that could be exposure to radiation. I know that is a hard thing to hear because sometimes we're exposed to radiation in treatment. Or environmental exposures could be where we work or cigarette smoke. We all know what hormones are. So part of our job here is to lower inflammation in the body, for example, to give the border control an easier time to catch mistakes so that we can then upregulate that border control and do a better job of not passing on that error. But while we're doing this, patients are often getting a lot of different kinds of drugs like R-CHOP, for example, or EPOC, for example. You guys have heard of rituximab. You guys may have heard of Cytoxan. You guys may have heard of doxorubicin, or vincristine. So I'm going to skip prednisone because it doesn't really matter right now. But the point is that a lot of these drugs have both short and long-term side effects. So our job together is not just to lower inflammation in the body, slow the rate of cell growth, upregulate your border control so it catches those errors. It's also to fight the short and long-term side effects from these drugs to protect your normal organ function so that you can do a better job of recovering from this disease and staying in survivorship. For example, doxorubicin has both a short and long-term effect on the heart that can last anywhere from months to 15 years. But there's a lot of natural therapies that will fight inflammation and at the same time lower the risk of side effects from doxorubicin, not to mention a lot of nutritional strategies as well. Thank you for that. So let's go back to this diagram here and look at this third part. So the third part is multiple mutations. So multiple mutations means if I draw my beautiful patient over here, and this is going to be a generic, and again, not the greatest drawing you've ever seen in your life. My patients are much more gorgeous than this. That's actually Christina. So the question is, why did my cells make this mistake in the first place? What causes my cells to make this mistake? And so as Steve just mentioned, these come from what we're eating. They come from environmental exposures, which we mentioned before. For example, cigarettes, alcohol, and drugs. Can you go ahead and mute them, Christina? They come from exercise or lack thereof, lack of sleep, stress, our spiritual outlook, because it has an impact on our immune function. And that's a big impact, actually. Nobody ever asks us about spiritual health, but the reality is most of the data in managing side effects and lowering risk of progression and recurrence is around mindfulness-based stress reduction. So don't hesitate to ask us. Family history and genetics. So our job when we see patients is to look at all of these pieces and figure out what's causing these mistakes while upregulating your border control so it catches these mistakes, lowering the rate of cell growth, and preventing the side effects from these drugs. Now, you might be thinking, well, what exactly is your job, especially if you've never seen us before? And we didn't do a very good job of letting you know that. So I'm going to let you know that. And then we'll switch over to talking about nutrition, since that's the only question we got so far. We are, and I'm going to actually have Dr. Mensah step in here. We are natural medicine doctors, but we're fancy kinds. So what does that mean? That means we have both the conventional medical training and the training in natural therapies. And we are board certified in what's called integrative or naturopathic oncology. So in addition to medical school and residency, we do specialized training in a hospital or clinic setting in just cancer care for 3 to 5 years to become a board specialist in this field. So that means we're experts in this and pretty much idiots in everything else. Would you say that's true?
Absolutely.
So there's about 75 of us in the US and Canada, and it's hard to find us. However, we have a very good relationship with oncology here. So our patients are usually a direct referral from oncology if you're in Michigan. Our job, our board specialty, meaning our expertise, is on the interaction between natural therapies, nutrition, and cancer care, so surgery, radiation, and drugs in a cancer population. So we're skilled in how those things interact so that we can optimize your outcomes. So that's who we are. And again, we should have said that from the beginning, but at least we got it in there. Okay, so I see a couple of questions here and I appreciate that. Thank you, Joyce. We're going to start with nutrition. So we'll open this up as a Q&A and you guys should jump in by unmuting yourselves or going on the chat. So Dr. Mensah, what are nutritional strategies that have evidence with hematological cancers? And by evidence, I mean, is there any clinical evidence for nutrition in terms of lowering risk of progression with, let's say, an AML?
That's a great question. So not just with AML, but with a lot of our hematological cancers, what we want to do nutritionally that has data backing it is getting a wide variety of fruits and vegetables. Now, you might want to ask why. So if you remember, from what Dr. Roy was explaining, there's that kind of 3 sections chart that we went through. One of those sections talked about inflammation. And if you remember what she was talking about with inflammation makes our cells run too fast for our border control. When we get a wide variety of fruits and vegetables, they are packed with nice and wonderful nutrients that help pull down the inflammation, that help slow down the cells from running too fast, and give our border control a chance to catch these mistakes that are happening, which can help us slow the progression in our cancers.
So in other words, would an anti-inflammatory diet then be effective for people who are worried about nutrition with hematological issues?
Absolutely. An anti-inflammatory diet would be one of the easiest things that we can do. If it's something to say, I may be in between doctors, I'm waiting to see Dr. Mensah, I'm waiting to see Dr. Roy, what are things that I can start looking at in my kitchen right now, is thinking about what foods will help pull down the inflammation.
So could you give us some examples besides fruits and like what kinds of vegetables, for example?
That's a good question. So green leafy vegetables, also thinking about our berries, which are rich in antioxidants.
But I know with hematological cancers, we're also concerned about exposure, as we said, to parasites, for example, or exposure to bacteria. What can we do when we're bringing home those fruits and vegetables to make sure that we're tolerating them well? And go ahead.
That's a great question. And she read my mind because she's always 2 or 3 steps ahead of me. So if we miss the comment, what we're talking about is thinking about hematological cancers and how we are compromised, so how our immune system needs a little bit extra support fighting things like viruses, bacteria, parasites. A lot of those things, we get those exposures from unclean produce or produce that we're not washing or produce that wasn't processed properly. So when we return home with our produce, things that we can do is putting all of our produce in a bowl that has a mixture of water, apple cider vinegar, baking soda, and letting it sit in there, right, for 5 to 10 minutes. And then once we remove those, we can get the debris, we can get all the little creepy critters that are on our produce that can leave us predisposed or exposed to bacterial infections, parasites, etc.
And then I also like patients to consider cooked foods, like cooked vegetables and fruits better because one, they're more easy to digest. So when we're going through chemotherapy, transplant, radiation, we tend to have a compromised gut.
Yeah.
And the problem with having a compromised gut, to my understanding, is doesn't most of our immune system live in our gut?
That's a wonderful point. Yeah, the majority of your immune system lives from the tract or the trail or the railroad track that starts from our mouth that goes all the way down to our bums. That's our mouth, our esophagus, our stomach, our small intestines, and our large intestines. That's where the majority of our immune system is. And why we want these cooked foods is one, they're easier on our digestive system, that railroad track that we're talking about. They're easier to digest, to pull out all those good nutrients. It's easier to process as well.
And then the hard part with the microbiome or the good part is that lymphoma, leukemia, they're really, even though you're getting kind of inundated with treatment, they're really isolated to specific parts of your immune system. But a large part of your immune system that's still active and hardy is in your gut, unless, of course, you have a gut associated disease. And that immune system can be optimized with nutrition and supplements, although we have to be very cautious with probiotics. So one of you asked, what about if my neutrophil counts have dropped really low, below a 1, for example? What can I do to support my neutrophils? So a couple of things I want to just answer, and I'm answering questions. We're answering questions in order, but we're going to try and weave them together. So just keep piling them on and be patient with us. Um, Neutrophils are I lost my train of thought there. What was I going to say?
Neutrophils and how to improve them.
Oh, and how to improve your gut, right? So working on our gut function through nutrition and supplements, I was going to say, oh, should you use probiotics is what I was going to say. So it's a challenge to use probiotics if your total white blood cell count is below a 2.5. And I don't like to use probiotics if your neutrophils are below a 0.5. But your neutrophils, my friend, are closer to a 1. A 0.8 is not as bad as you think. And to boost those, really, you need rest, a little bit of stomping around, and we see good data with a mushroom called maitake. I'm going to put it in the chat while we're talking. Maitake, when I say data, I just want to make sure everybody knows what I'm meaning, what I'm saying here. We are not in Michigan, naturopathic medicine is unlicensed, so, or natural medicine is unlicensed. So there is no regulation around what is safe, what is effective, what is clinically evidence when a natural therapies person is talking to a patient. So for us, in order to keep you safe and make sure we maintain that relationship with oncology and get you the best outcomes possible, we only really advise clinically evidenced therapeutics. So when I'm talking about clinical evidence, I'm talking about things that have been shown. Oh, shoot, I don't even know what's on my desktop here, but that's not going to work. I'm talking about things that have been shown in clinical trial to be effective. And where do you find those things? You would go to pubmed.gov. Pubmed.gov, pubmed.gov, is where the government publishes all clinical data done anywhere in the world at any time. So we were just talking about something called maitake, or we could even just put in mushrooms just to make it even more robust right now. We capitalize "and" to exclude it, and we put in cancer. And as you can see, there's 2,600 or 2,500 studies that were done on mushrooms in cancer treatment. Now, I can filter this data on the left here. I can click on clinical trial, and it'll pull up just the human trial data, which is still pretty good for mushrooms in clinical trial. So these are trials in a hospital setting with a human population typically. And this is, I can change this word as we move forward so that I can make my data more specific. I could look at maitake and cancer, and you see that maitake has a lot more data. And I could look at maitake and neutropenia, which is one of the conditions that somebody has posted on the chat, to see what that data looks like. So when we're talking about data, we're talking about things that have been shown in clinical trial to be effective. The problem with mushrooms is that they're heavily contaminated over the counter. And the reason why is they're mostly sourced out of China or poor quality farms. So there's not regulation on a federal level for soil and water contamination. So there's only a couple of companies that we trust that do third-party tests for contaminants. Also, if you're getting them from overseas, laborers are usually paid by weight of bag. So of course they put things in the bag that can contaminate the product. A good company here in the States is Host Defense. which does a really good job of looking at clarity. But then we also have to think about dose, meaning what is a therapeutic dose of mushrooms? And that varies per person. So we're not going to give you specifics there because we don't want to treat anybody over a Zoom call. Okay, good. So I see a lot of good questions coming in. What about meditation? So do we do meditation instruction? So Joyce, we don't do meditation instruction. What we do is talk about meditation and give you resources for very powerful guided visualizations. We might, if a patient is really struggling in the visit, we might do a guided visualization or a guided meditation with that patient. We are not certified in instructing on meditation. However, if I go back to pubmed.gov, we're going to go back to that website we were just looking at, and I put in MBSR, or mindfulness-based stress reduction in cancer. And I look at the top here, you'll see there's 172 clinical trials that look at the prognosis with cancer and mindfulness-based stress reduction. What is mindfulness-based stress reduction? It's just meditation combined with yoga and breath work. And there's 2,000 studies on just mindfulness alone. The data is super, super robust here, that mindfulness is one of the most powerful techniques you have for optimizing your outcomes. And it may feel hoodoo voodoo, especially for doctors to be discussing it, but we're of the belief that all of you comes to bear when you're talking about a cancer diagnosis, because what we're trying to do here is we're trying to optimize the way that our mind or our cells perceive the environment around us. And we do know that spiritual outlook and what we hold in mind does have a big impact on prognosis and how cancer works. There's 5,000 studies looking at prayer and cancer, and we're not proselytizing. Certainly, Dr. Mensah has a very different spiritual belief system than I do. However, I want you guys to see how powerful this is. One of the websites, Joyce, that we really love is called healthjourneys.com. And Christina wanted to mention that Gilda's offers a lot of these things, Joyce, like they have an MBSR class, for example, and everything Gilda's does is free for patients. You can just post in the chat, Christina. Healthjourneys.com has a library, an archive of guided visualizations that are just for cancer patients. So you could put in cancer and you could see visualizations just for fighting cancer, for radiation, for optimizing radiation therapy. But one we really like a lot for our patients is called healing trauma, because so much of what you're going through here is triggering older injuries and causing a post-traumatic stress response, which then raises inflammation in your system and makes cells grow faster. It changes the way your body uses cortisol. So we love this healing trauma guided visualization. It's narrated by a woman whose husband struggled with lung cancer, and it's a beautiful guided visualization to really help you there. So we're going to keep moving on through all these questions. Thank you for posting them. They're beautiful, and we love it. So what are the really pro-inflammatory foods, Dr. Mensah? Maybe you could mention some of those.
That's a great question. Pro-inflammatory foods would be our foods that are processed foods, like our fast foods. I know every once in a while we love to stop by, and that's wonderful. We also want to think about our foods with our saturated fats. So our processed fats, those oils that are hydrogenated oils, so those unhealthy oils like our canola oils.
So anything that's been fried or fried twice would be a problem, right?
Absolutely.
And then highly processed foods would be foods with nitrates or nitrites in them. And then What about red meat? Is red meat a problem with leukemia lymphoma?
Red meat is a problem, not just with our hematological cancers, but if we look at guidelines, we see that red meat has a problem across many cancers because it's very, very pro-inflammatory.
Well, what if it's grass-fed, grass-finished? Is it as pro-inflammatory as chicken?
That's a great question, and a wonderful loophole for those of us who must get those red meats in our diet. Now, why we want to get, as Dr. Roy said, grass-fed and grass-finished red meats. That's because those type of red meats were animals that were not raised on antibiotics or hormones. Those were things, if you remember back to that chart that Dr. Roy showed us earlier, that drive up the rate at which cells are going to be running and dividing.
Yeah. So someone's asking a question here about, and again, if we didn't answer it fully or you have more questions, follow-up questions, just put them in there. We don't, when we're talking about how we treat patients, I'm going to go back to that. I don't know why I have that screen up, but I'm going to go back to this screen. Um, when we're talking about how we treat patients, if this is the patient that comes to us, we're not just using nutrition. We're not just using chemotherapy. We're not using chemotherapy. What I mean is, as a treatment team, we're not just thinking about chemotherapy, transplant, radiation. We're also thinking about nutrition as a therapeutic modality, but we're also thinking about supplements and off-label drugs. We're also thinking about mind-body medicine, which we talked about. We're thinking about body work. So massage, Reiki, craniosacral have a lot of data, for example. Nutraceuticals, so how we use protein in protein drinks. Different kinds of anti-inflammatory powders. So going back to the anti-inflammatory, for some of our patients, we may design a shake using nutraceuticals and different kinds of formulations to lower inflammation in the body. And how we track that inflammation is really important. So we use sophisticated blood work, which is covered under your insurance, to manage your progress as you're moving forward and track how inflammation is coming down, as well as looking at how your other organs are. I'm thinking of trying to do multiple things at once. That's why I'm talking slowly. How your other organs are doing. So protecting your heart, your liver, your kidneys, and your lungs. Kidneys are very, very vulnerable to treatment. So part of what we're doing here is making sure we manage that piece. So all of these things that I'm drawing in this circle here are really a holistic, comprehensive cancer model and should be standard of care, because while chemotherapy, radiation, transplant are necessary for our patients, these other opportunities are not benign. They're absolutely critical in terms of optimizing how your system works. Okay, so I'm going to come back to some of these questions here. What about plastic? How safe are deli containers that say dishwasher and microwave safe? Should we be tossing those and using glass? So that's a very complicated question to me, because I don't want you tossing them either, my friends. So a lot of our bodies are really connected to the environment. A lot of this epidemic that we're seeing with cancer and other diseases, heart disease, diabetes, is connected to how we're treating our environment. So dumping those plastics or tossing them away, they just get fed back to us in a different way. They come back through our water, our soil. They come back in different ways that end up even in our sperm and in our eggs, and end up even in our children as we move forward. So I love to think about how we protect the environment as part of how we protect our whole health, or health for future generations, right? I think plastic was a wonderful invention, and I'd like to see it outlawed as it is in other countries. And the reason why is it does leach a lot of chemicals that do cause cells to make mistakes. And that's a problem. And when you heat up those plastics, what happens?
When you heat up the plastics, all of those chemicals that are in the plastics can move into, let's say, if it's a plastic container for your tea or your coffee, all of those things then go into your liquid drink that you're trying to enjoy. They also can go into your food. And then also one thing that we want to think about, we often use these plastics and reuse the Tupperware. So we might just put the whole Tupperware in for leftovers, take what we want out of it, and then put it right back into the fridge and reheat it again. So every single time we're reusing, reheating
You're
this plastic.
changing the conformation of your food,
Mhm.
but you're also storing those chemicals in your fat tissue. So, a big piece of how our body manages the world around us is it detoxifies what we're breathing, eating, drinking. We're being very poor examples right now. Breathing, eating, drinking, and it stores it in our fat and processes it that way. So, it can be really hard then when we're losing fat stores because it raises those chemicals and the inflammation in our system as we lose weight. So one of the reasons why losing weight during treatment is not good for you. What about the keto diet? Is it very good for cancer patients?
That's a great question. In certain cancers, yes. Now, there are terms and conditions. If you are a patient that already has difficulty managing your body's packaging system for fats, the ketogenic diet might not be the best for you. Because one, what we want to do is part of those things that we're looking at is your metabolism. That's a part of that multiple pronged approach that we have in treating you, right? So if we know that you either have high cholesterol, a family history of dyslipidemia. So my body gets in fats, instead of storing it away, they might put it into places that aren't optimal for my health.
Like your heart or your blood vessels?
And then, so when we have that ketogenic diet, what that means is instead of being a creature that uses the sugar for fuel, we're now shifting to using the fats as fuel. And then when we're using these fats as fuel, we just keep putting more and more fats in our body. Now, in certain cancers, we'll say, okay, this cancer no longer gets sugar, but that the opposite side of that is if we already have an issue packaging these fats, we might be dumping more onto an issue that we need to solve.
So what you're saying then is there is some data with some cancers, like for example, glioblastoma,
Mhm.
where it can be effective. But for a hematological issue, we really want to stay focused on that today. A ketogenic diet is not an effective diet in terms of the clinical evidence. Um, is it sometimes effective for some people? Possibly, but we get really nervous about patients losing weight. And for us, optimizing our weight or maintaining our weight during treatment is so critical to
Mhm.
doing well with treatment. And oftentimes when patients are diagnosed, they get on the internet and they're not on pubmed.gov. They're on instead Google. And they're getting so much information that tells them this is fighting cancer, this is causing cancer, none of which or most of which is not true. Rice and bananas don't cause cancer. Neither do Kit Kats, frankly. Cancer is caused by, as we just saw, a multiplicity of factors that come together to make this disease possible. And fighting it requires a sophisticated, personalized, multivalent approach. So I hope that was helpful with the ketogenic thing, which doesn't mean that there's not
Mhm.
certain nutrition strategies like intermittent fasting or a macrobiotic diet or a Mediterranean diet that don't have data. And it doesn't mean that for one person who might have an autoimmune disease
Great.
plus a hematological cancer, an anti-inflammatory diet with restrictions might be beneficial. It depends on the patient. I hope is that right?
Absolutely.
Okay. So let's see some of these other questions here. Um, how about multiple myeloma in a smoldering stage? This is a great stage, even though it is really hard to get that diagnosis. Remember, when we're talking about multiple myeloma, we're talking about a myeloid cell, which is responsible for making all those other types of cells that made a mistake. But in the case of multiple myeloma, it's actually a plasma cell. So it's a type of soldier that's supposed to do a job, but instead piles up onto itself, smoking cigarettes, looking at magazines, flirting with other people walking by, and they don't actually do their job. So these little clusters, they get stuck in your bones and in your kidneys, and they cause fracture and kidney disease. But a smoldering diagnosis or an MGUS means we have a precursor lesion. We are not there yet, and we may never get there. Sometimes it takes 15, 20 years to even progress. That's a great time to see a doctor like us. And there's a couple of us in the state that works on optimizing your body and making it inhospitable to cancer cell growth. There's one or two therapeutics that have excellent data with smoldering or with MGUS. And those, for example, are curcumin is one of those. Curcumin's problematic, however, because it comes from the root turmeric. Turmeric is sourced mostly out of India. And when they import it, they use a 1,2-dichloroethane to clean it. And that is a carcinogen itself, and it remains on the herb. Because the federal government regulates supplements the way they do it through the USDA instead of the FDA, so they regulate like a banana, not like aspirin. It means that you can get contaminants in supplements that cause cancer. So curcumin, which is an extract from turmeric, if given in very high doses, combined with a fat, like we were just talking about, with someone with a good gut for absorption, that can be excellent for an MGUS situation. However, it would have to be from a company that third-party tests for that solvent. So that can be an issue. And some of those companies don't sell to patients directly. But there is a lot you can do besides just nutrition. Supplements can be very effective for an MGUS situation. How do we feel about the Mediterranean diet to control inflammation?
I really like the Mediterranean diet, actually. I like prescribing this for patients because in that Mediterranean diet, one, it's not restrictive. And as Dr. Roy was saying, we really don't want to restrict. We really don't want you losing weight. In that Mediterranean diet, one, comes with fruits, it comes with vegetables, it comes with nuts, it comes with seeds. You can have
Fatty
fish.
fish.
Fatty fish, absolutely. All of those things are working together in different ways to tackle inflammation in the body.
I think that's a really good point. And actually, Mediterranean diets have a lot of data, particularly for heart disease and diabetes. And unfortunately, some of these things go hand in hand. So as we talked about, some of our cancer drugs like doxorubicin, epirubicin cause heart disease. When we're getting these drugs, we're also getting prednisone or steroids chronically throughout treatment. Steroids change the way the body uses fat and sugar and can raise our lipids over time. And unfortunately, when our primary care doctor or our oncologist is doing surveillance on us post-treatment or even during treatment, they're not managing for new and emerging metabolic changes, meaning how your body uses fat and sugar. So using a diet like a Mediterranean diet hits multiple birds with one stone, and it's highly evidenced, as is a macrobiotic diet, which is like a Mediterranean diet, but includes a lot of legumes, beans, grains, and sea vegetables. It's like a sort of a faux Japanese diet. So I see a question about intermittent fasting. So tell me a little bit about intermittent fasting, Dr. Mensah.
So
Everybody cares about nutrition. They never care about every time we go through these.
Intermittent fasting. So when we think about how one is normally eating or usually eating, we might finish dinner around 8 p.m., 9 p.m. sometimes. And then our next meal after that, the break fast or breakfast, happens somewhere around maybe 9 or 10 the next day. When we intermittent fast, what we're doing is the time in which we're not eating, so the fasting window from dinner to breakfast the next morning, we stretch it out longer. So that either means we move dinner up earlier or we push our first meal in the day later. Now you might ask, why do we do this? When we intermittent fast, what we're doing is we're giving our body time, one, to catch mistakes. right? And when we're catching mistakes and eliminating mistakes, we're stopping those mother cells from passing those mistakes on to the daughter cells. And remember, when Dr. was talking at the very, very beginning, when the border control is out to lunch and misses the mistake, and that mistake is passed on, that's what gives us cancer, right? We also can talk about it differently. So we were just talking about are those metabolic markers that can change when we're on things like prednisone, when we're taking things like doxorubicin in treatment, right? When we're intermittent fasting, our body starts to use up the excess. So the excess sugars, the excess fats that our body is trying and struggling with to process and says, okay, my backpack can only hold 10 fats and 10 sugars. And we just ate 15 fats and 15 sugars. So what intermittent fasting does, it helps us take off those extra 5 fats, those extra 5 sugars, so we package everything in our body safely.
Yeah. Um, so I think that's a really good way to put it. And again, is intermittent fasting the right choice for every patient? Not necessarily. So someone is asking, how do you find a doctor like us? So one, you can click on the link that I very unskillfully posted here. And you can just ask questions on there. You can either remain anonymous or give us your email or your phone number, and Dr. Mensah or one of our staff will give you a call and answer questions. And that's another way to reach us. Also, you can go to oncamp.org. That stands for the Oncology Association of Naturopathic or Integrative Oncologists or Physicians, excuse me. And you can click on Find a Doctor. When you do look for a doctor, it should be someone with the letters FABNO after their name, which stands for Fellow of the American Board of Integrative Oncology. You want to be really cautious about seeing someone who's board certified. In the Denver area, I really like Brita Muti. Just because somebody is asking, I know this is very specific. I'm sorry. I don't mean to shout out Brita, but I think she's one of the only fab nos in the Denver area, and she has multiple clinics and she's hospital privileged. So I think your insurance actually covers in Denver. So definitely you should see her. Don't try and see us. I'm actually closed to new patients until August, but Dr. Mensah is taking new patients still. And then in August, I'll reopen. We just want to make sure that we're really serving the patients that we have. But you should not hesitate to reach out to us with any questions, and we'll be happy to direct you. But coming back to some of these questions here, Christine, I didn't see that we missed anything. I did go back and check. But thank you for being more specific. So while we're waiting for you guys to gather your thoughts, maybe we can take a couple of minutes and talk about side effects. And after that, we'll talk about exercise, right? So in fact, let's work in exercise. One of the most common side effects with treatment for multiple myeloma, AML, B-cell lymphoma is fatigue. And it can be really hard and really profound. And why is that? It's because remember that those cells that are being made in the bone marrow include your red blood cells. Red blood cells are pickup trucks that are delivering gasoline to your tissues. Now they are a civilian casualty of the chemotherapy because the chemotherapy is like Terminator. It's like, doot, 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 doot. It's looking for fast growing cells. And I'm sure all of you are my age or older, unlike this guy. So you know who Terminator is. Christina's laughing at all my jokes in the corner. I can't see any of you. But so because of that, red blood cells get hit as part of your treatment, and that can cause that fatigue. Red blood cells have a lifespan of 120 days. So they do regenerate. And the new ones have never seen treatment. They're perfectly healthy. However, it takes time for them to regenerate. In that time period, exercise can be very important. It sounds crazy. Why should I exercise? Doesn't that use more fat and sugar calories? Aren't I using my red blood cells? Well, data shows us, and again, when we're talking about data, I want you to go to pubmed.gov. I don't want you to go to Google. That 15 minutes of low intensity exercise per day is actually very helpful in fighting fatigue, even if you feel like you can't do anything at all, making a loop around the house. Also, jumping on a trampoline safely, guys, like holding something, or stomping up and down the stairs. Any pressure on the bone is going to force the bone to produce more red blood cells and white blood cells. There are strategies that your doctor has called growth stimulators that will improve the amount of red blood cells and white blood cells that your bone marrow is making by putting pressure on your bone marrow to produce those cells. Those can be drugs like Neulasta or
Mhm.
Procrit, for example. However, those drugs do have some side effects that can be challenging for you. So you want to be seeing someone like us to prevent those side effects. Again, we want you going through treatment feeling well. Our patients go through treatment with little to no side effects and end up on the other side feeling fairly well and normal. And that's where we want you to be. So in terms of exercise, that's where we would advise. Now, if you're far away from treatment, let's say someone is
Mhm.
5 years out in
Yeah.
survivorship, they've got a little bit of a belly from steroid exposure,
Mhm.
they're working on metabolic health.
Yeah.
What would be the right exercise program for that person?
That's a really good question. So
And no mobility issues, let's say.
that's a great question. So things that we would think about doing is getting anywhere from 45 to 60 minutes of exercise daily,
Holy
right?
crap,
And now
45 to 60.
that's a
I
lot.
was going to say 30 minutes.
That's a
That's
lot. So things that we can do, that's not consistently, I'm going to start at 1 o'clock and go to 1:45 or 2 p.m., for example. That can be, I can wake up and I can do 10 minutes or 15 minutes. I can stop right before lunch and another 15 minutes, and that's a 30. And then right before dinner, I can just take another quick 15 minutes. And that's your 45 right there.
Awesome. But
Mhm.
isn't there some data around high intensity
Mhm.
training for someone who's well out into survivorship? If they're ambulatory, if they have no
Yeah.
mobility issues, and they're working on metabolic health.
That's a good question. So we're saying high intensity interval training, right? That's different from having a low intensity for in a treatment, right? With dealing with fatigue. Why we're seeing that the high intensity training works is because when we're walking fast, super fast, let's say we want to walk for 20 minutes total, and then for 5 of those minutes, we're just walking as fast as we can to build our heart rate up, right? That's the high intensity that we're looking for. What that does is it opens up new doorways into our muscle tissue because our muscles are saying, oh, I need more energy. So I need sugar faster. I need these fats faster. So instead of waiting for a delivery, of course, from our foods, from the liver, for example, our body says, okay, let's just open up the doors and just get an expedited shipment of sugar into these muscles to use that energy while we're exercising. Why that's helpful for us is because it pulls down that excess, right? Not what we need for our day-to-day living, right? We pull down the excess fats, the excess sugars that we normally can't process on our own.
Now you can see Dr. Mensah is very young and very fit and a vegan. I'm going to disagree with him. High intensity interval training only needs to happen for 20 to 25 minutes to be effective, but I do agree that the data shows us that long-term cardiovascular exercise for 45 minutes a day, 4 to 5 days a week, is helpful for reduction of recurrence in solid tumors. But we want to stay really focused on hematological. Doesn't mean that he's not very good at what he does. He's just a little biased. But I agree with everything you said about him about high intensity interval training. What about empty stomach cardio, like waking up in the morning and doing a gentle walk for 20 minutes? Is that helpful as well?
That's helpful. And I want to put the key word on gentle. Because one thing that we want to be careful, even when we're doing the high intensity interval training, we really don't want to drive up stress in the body. Because remember, those are one of the things from Dr. Roy's chart, stress can inadvertently drive up inflammation, right? So when we're having that early morning, that first thing in the morning, gentle cardio, that's a walk, that can be a quick paced yoga, for example, as well. That's when we're kind of pulling down those excess sugars that we did not digest overnight. We did not process or package overnight.
And because the body's not in an alarm state where our cortisol is really high, it helps the brain to manage hormonal health such that we start to release fat stores, and not feel like we're in a fasting state,
Mhm.
right? So I see a lot of questions about blood work, and I'm going to try and share my screen with you without sharing a patient's name here, so I can talk to you a bit about blood work. Um, and let me see here. Okay. So I don't think you can see a patient's name here, and I'm going to make sure that that happens. So when we are seeing our patients, they come in, and we might be drawing all kinds of different labs to look at inflammation, to look at white blood cells, to look at red blood cells. So I want to answer the specific question first about hemoglobin, and then I'll come back to some of these other markers. Um, so let's look here at this person's bone marrow. Give me 1 second. Here we are. You can't see anything, right?
Mhm.
Okay. So if I was talking, and again, I know some of you are already our patients, so I apologize for this being a little bit on the boring side for you. Hang in there. It'll get exciting soon. So this is looking at this person's bone marrow. All of these cells are made inside of our bone marrow, as we talked about before. Our white blood cells are our military. They fight infection in the body. And then all of these other cells down at the bottom here are types of white blood cells. So neutrophils fight bacterial infection, lymphocytes fight viral infection, monocytes fight mold, pollen, and food sensitivities. Eosinophils and basophils fight parasites. These platelets here are the glue when we cut ourselves that sticks things together. So what I'm seeing is a good total military. And when I'm looking at her total numbers here, her neutrophils look excellent. Her lymphocytes look excellent. Her monocytes are on the higher end of normal, which means she's having slightly of a site sensitivity or allergy, either to the environment right now or to treatment. And her parasitic immunity is intact. But one of the group is asking about red blood cells. I just happen to be super comprehensive and like to explain everything. So I hope I'm not being redundant here, but red blood cells, remember, are pickup trucks. They pick up oxygen and they deliver oxygen to your tissue. Hemoglobin is the flatbed on this truck that holds the oxygen on there, and hematocrit is how much traffic there is. Your MCV, MCH, MCHC is the shape, size, and color of these trucks. It tells me if you have the nutrients in the factory to build these trucks, okay? And she's doing beautifully here. But some of you may have a low hemoglobin, as you're telling us in the chat. What does this mean? It means you don't have enough pickup beds to hold the oxygen on there. Now, what can we do about it? Oftentimes, your primary care provider, or sometimes even oncology allied professionals like nurses, make the mistake of giving you folic acid or iron, or somebody might tell you to take a multivitamin. Iron is the hinge that holds the oxygen on this flatbed. It does not impact the hemoglobin. More importantly, our iron, our hemoglobin, excuse me, our cancer cells need iron and folic acid to grow. So feeding your body iron and folic acid just to raise your hemoglobin can have a counterproductive effect, particularly post-transplant, where we don't supplement at all, at least for the first 6 weeks minimum. However, going into transplant, we like to see optimal levels like we see with this lady. So the question is, well, what can we do about our hemoglobin? So nutritionally, what are some of the things we can do? Like bone broth?
Mhm.
What kinds of things can we do for hemoglobin?
Bone broth, as we just said, those root vegetables, so vegetables that are growing into the ground. Now, you might ask why, because my favorite vegetable is broccoli, Dr. Mensah. And I was like, you can 100% still eat your broccoli, but the root vegetables, because they're in the ground, they're absorbing the nutrients into the rhizome, for example, that we're eating. and we eat that nutrient dense piece of the plant.
Oh, that's so fascinating. So what you're saying is you're getting a natural multivitamin that helps to restore some of those mineral and nutrient depletions that help to build red blood cell tracts.
Absolutely.
Wow, that's beautiful. Bone broth, I thought we said that we couldn't eat red meat.
That's awesome.
See, gets caught in his own
There are
game.
multiple loopholes to this. So whenever I say no red, if I ever say no red meat to you, you have multiple options still. Okay.
Or you can come see Dr. Roy, we'll argue with you. So beef bone broth,
Mhm.
especially grass-fed, grass-finished, Kettle Farms is a good brand, is a better mineral doser. And we're talking about nutrient ways of getting in a multivitamin instead of
Yeah.
taking a multivitamin. Is better for you than chicken bone broth, which often has high levels of arsenic. So we want to, which can aggravate particularly fatigue with an AML or chronic lymphocytic leukemia. Okay. So we're coming up on time here, and we have a lot of questions. So we're just going to wrap up on a couple of these. So I think this cortisol question is really important, and then we'll come back to infrared sauna if we have time at the end. So what role does cortisol play in losing or gaining weight? Is it something that needs to be controlled? So that's really an important question and a kind of a fascinating thing as well. So I'm going to take away this model, although I want you guys to remember this. If you go to, in fact, I'm just going to clear this. I'm going to stop that. I'm going to go to the internet again, and I'm going to pull up our website just because I want to show you one thing. I hope I didn't get rid of anybody. Did I? I didn't, Christina, did I? Okay. So if you go to our website here, ignore these beautiful ladies. They're not around anymore. And scroll to the bottom here and you click on videos. There's some great talks from Gilda's on here actually that you can take a look at. But one thing I want you to take a look at that I think is really important is a model for what a comprehensive cancer model should look like. Because I want all of you to really insist on having that level of care. And it's called our unique approach to care, which is not truly ours. It should be applied, it should be a part of every comprehensive model, but it really goes over all of these parts and pieces that help you to optimize your health. So coming back to that question about cortisol, so these are your kidneys. Oh, and I wish we had had time to talk about your kidneys. Maybe we'll try and bump it in the end or sneak it in the end. On top of your kidney here is your adrenal gland. And your adrenal gland is responsible for making something called adrenaline. Adrenaline. The other word for adrenaline is cortisol. So anytime you have a stress signal, like if I clap my hands really hard, even though Dr. Mensah stayed super poised there, his heart rate actually jumped up a little bit and he experienced a small stress signal. That stress signal sent an alert to his adrenal gland, which released adrenaline or cortisol. Cortisol goes to the liver and tells the liver to dump sugar into the bloodstream. Why? Because when we were created or evolved, whatever you believe, it was at a time where we only had acute stress, meaning we needed to run and hide, or we needed to freeze and not be noticed. So like saber-toothed tiger running towards you, baby falling in a river. So you need sugar to be able to run and do those things. So sugar goes in a fast bolus to your heart, your lungs, your feet. These are supposed to be Flintstone feet here, to help you to run. The problem is that as civilization has moved forward, our bodies have not evolved or whatever you want to call it, to adapt to chronic stress. So we no longer, we don't just have acute stress, but we only have an acute stress system to manage chronic stress. So we don't have a hand clap or a baby falling in a river or a tiger running towards us. What we have is worrying about our bills, worrying about our children, worrying about what's going to happen next, being afraid of getting in a car accident, having our boss yelling at us, being late for a talk, our internet not working, having technological difficulties. All of these things will cause this stress system to activate. When this stress system activates, cortisol runs through the liver dumps sugar into the bloodstream. However, we are not running. So sugar starts to rise in the bloodstream, and that changes the way the body
Mhm.
manages nutrients. So stress is very highly linked to how we use nutrients. It also is highly linked to sleep. So there's a clock that is hardwired into all of our bodies, and that clock goes off at 3 a.m. and it sends a beep, 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 small stress signal to our adrenal glands. Our adrenal glands will release adrenaline or cortisol, which goes to liver and dumps sugar in a slow bolus between 3 and 6 a.m. Sorry, a slow drip to our heart, our brain, our liver, our kidneys, our lungs, etc. And what does that do? It slowly wakes us up over this 3 to 6 a.m. period. That's why we wake up at all. However, if we go to sleep worried, we go to
Mhm.
sleep stressed, then this alarm system, when it goes off at 3 a.m., goes beep, 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 and we wake up. We usually go into the bathroom, we're kind of tossing and turning, and we have poor sleep between 3 and 6 a.m., are very tired when we wake up, super alert with our coffee, then crash later in the day, and so on and so forth.
Mhm.
And that changes how our body uses fat and sugar. So stress is a big piece of managing how our body uses fat and sugar and whether or not we're making that sugar available for cancer cell growth. Okay. So if we nailed anything at all, it was mindfulness-based stress reduction. But I would love to have had the chance to talk to you guys about side effects, particularly protecting your kidney health, which is really at risk with a multiple myeloma, but also hematological malignancies and chemotherapy. And I would have loved to have a chance to go over chemotherapy and transplant with you guys and what can happen and what we do to prevent that. But that's for another day. Um, and we'll close with this last question on infrared saunas. So how do
Yeah.
infrared saunas work and are they effective for cancer care?
Mhm. I can't say that they're specific for our hematological cancers, but there is data on infrared saunas, not just a regular sauna, but infrared sauna. And that's because the wavelength, so the way that the light of the infrared dances on and through our skin, helps us lower inflammation.
So as you can see, I put in infrared sauna and cancer, and nothing came up in PubMed. If I put in infrared and cancer, there's 20,000 results. So it's not really about the sauna itself. It's about, as Dr. Mensah just mentioned, the length of the beam. And that length of beam is particularly anti-inflammatory. So if you have the means, which many of us don't, but if you do, it can be a very effective and very gentle way of improving your health and lowering inflammation in your body and fighting cancer. Sunlight and saunas will usually give you a discount if you use my name or our medical supervisor's name, Dr. Khan. We don't have any financial benefit from that. I'm just letting you know. Or Healthy Line makes some nice infrared mats, which you can get on Amazon. Or there's places that have infrared saunas that you can go and buy a membership to and sit in and enjoy. Okay, so I hope that was really helpful for everybody. I appreciate that, Steve. That's awesome. We love the kudos.